Hi, Paul Phrampus here, Director of Wiser, for another Wiser Minute. I want to talk to you a little bit about Fidelity and the design of scenarios. Fidelity is one of the most difficult words to understand in simulation. It is thrown about in a casual way. What fidelity is how much a given situation relates to reality. Okay, this most commonly gets used when we're talking about mannequins or environments. So it's like an environmental fidelity. How real does this environment seem compared to if we were taking care of this patient in the actual clinical environment? What's the relationship? How real does this piece of simulation equipment fit into the scenario? How does it relate to as if we were taking care of an actual patient? So you take your average high fidelity mannequin, or that is described as high fidelity. Well, if you think about it, no mannequin has high fidelity appearance. They all look like plastic dummies that have been stuffed full of pneumatics and computer parts. That being said, when you go to feel the carotid pulse or the radial pulse, there is an element of realism that probably is a high fidelity relationship if compared to a real patient. But go ahead and have a conversation with that plastic man and then come away and say that was a high fidelity combination. I think not. Another aspect of fidelity comes in with moulage. Many people, when they are designing their scenarios, put around elaborate moulage schemes. And we have to think about this because it takes a long time to create good moulage. It takes a long time to get a room turned over so a second team or a third team or a fourth team can experience the simulation. Moulage can really slow things down. It can make a mess. It can create stains on people's clothing, for instance, or on the simulation floors or the simulation center's equipment. I've seen all of this. Okay, so the main thing to think about with fidelity when you're designing your scenarios is to think about why are you running this scenario. You're not running this scenario to recreate reality. We are not trying to simulate reality. We are just trying to create an environmental milieu or a stimulus to the participant or participants so that they can drop into a role in a psychological contract with us, act as if they were taking care of a patient in a real environment, so we can form an opinion, deliver some feedback, often in the form of a debriefing, and help them get better for the future. We're not trying to recreate everything to do with the healthcare encounter. If you think about healthcare in general, it is extraordinarily complicated. We cannot bring in every aspect of the healthcare encounter that a patient will have. We have to extract from the healthcare environment that we need to bring to create this milieu to allow the participants to function in a way as if they were caring for the real patient. That's what we need to do with simulation. That's the operational realities associated with simulation. We have to be mindful of the amount of time that we have for the students, the amount of time we have for the setup, the amount of time it takes us to get ready for the next group of students, as well as the amount of time it takes to clean up the program for the whole day at the day's end. All of these things factor into the reality of a simulation program accomplishing its goals. So the next time you're designing your scenario, think about it. Think about fidelity. Think about why we're running this scenario. We are running this scenario to accomplish a set of educational goals and perhaps a set of assessment goals. We are not trying to simulate reality. For more on this topic or others like it, please visit our website at wiser.pitt.edu. Thank you very much.